me a sense of AMC and how it's grown over the past 10 years since you started?
Sure.
Since the company started.
Right. Yes, AMC recently celebrated its 10th anniversary, and since receiving our FDA approval in 2005, we've done over 75 different program implementations, served approximately 60,000 patients, probably deployed over 75,000 devices. And we developed, probably about 4 years or so ago, an IVR capability, interactive voice response, that's been used quite extensively to not only connect with patients, capture symptom information, but also drive educational content and to make clinical workflows more efficient. And that eliminates the need for nurses typically having to dial the patient and trying to connect. We see on average about, the IVR enables us to eliminate 3.5 attempts per call.
Great, so it's automated
It's an automated call.
like they use in call centers.
Professional voice talent can be used to record any template that a customer would like to deploy to a specific patient or patient population.
Now, AMC, please elaborate a little bit on this. AMC provides more services than it would technology. Am I right? Or
yeah,
correct me if
no,
I'm
that's right on the money. Right, we're not a manufacturer, so we actually incorporate. We're really device neutral, if you will. So we have a number of different manufacturers that we've deployed into our solutions, and we really work with customers in many instances. Excuse me, who may have purchased equipment from different grant applications, and they don't want to necessarily throw that equipment away. We can work with them to see if it's possible to incorporate those devices into our solution as well, and eliminate that as a potential expense for the program going forward.
So have you seen your market change or presumably grow over the past 10 years?
Oh, quite a bit.
Yeah.
Especially in the last, I would say in the last year in particular, given all that's taken place with regard to the CMS penalties for Medicare and 30-day readmissions. So we were fortunate enough to be a participant in the Geisinger program that saw published outcomes that saw 19.5% reduction in all-cause readmissions. And that's led to a lot of systems actually knocking on our door, asking us to see if we could incorporate some of what what Geisinger did in their model to enhance clinical workflows ultimately and have better outcomes to hopefully avoid those penalties going forward.
And how would you describe the size of your company? Because we see here at ATA all different sizes, big, small, medium, and I'll ask you another question later, but how would you describe
Sure. Well, I wouldn't say we're a startup, but we're still small. We're about 70 employees. We've doubled in size, I think, in the last 3 years or so. So business is good, but we're certainly not ready to go toe-to-toe with some of the heavies out there. But again, we're not a device manufacturer. I think what makes us truly unique is the more complete approach we take to identifying the design, creating the design of an effective telehealth program, and then working with our customers to collaborate and determine how we can fill a role where they may not have the resources to do it. So there's a lot of kind of evaluation that's taking place, and there's oftentimes a decision, oftentimes very late in the process, with regard to what AMC can do to help support and enable them to secure stronger return on investment or stronger outcomes from their programs. So, we really view ourselves as more of a full-service solution play as opposed to just a device manufacturer in the program.
One of my questions is, I was going to ask you how, as a smaller company, what role you feel, what do you bring to the table compared to, say, how do you play in the market compared with the Qualcomms and the Polycoms and whatever comms?
Yeah, I think I saw it a lot more probably 3-4 years ago, where people were more inclined to buy the brand. Buy a brand that everyone recognizes. I remember when Microsoft was emerging back in the early 80s, people would say, hey, you never got fired for hiring IBM. So we're kind of now seeing that people are realizing that the brand doesn't necessarily equate to a successful program. The devices are nice, but it's more than the device. It starts with the technologies, but it's really the support services that support not only the patient, but the clinician as well, that are critical to ensure a successful program.
Yeah, it sounds like there are so many needs, and there are different companies to fulfill a variety of them.
Yeah, and I think the more the more diverse the response gets, the more the variety of companies that need to be involved in order to provide the solution, the more complicated it gets, the more challenging it becomes. We try to do all of it. So there are some programs where we've been asked and hired to literally do it all from A to Z, and there's others where we're doing a piece here and doing a piece there just to supplement what our customers are already doing. In many instances, we're actually performing the clinical, for example, just as a means to enable our customers to drive adoption within their organization. So our ability to bring in the clinical expertise and the know-how with the idea and appreciation that it's going to transition in-house in 9, maybe even 12 months is a tremendous advantage for us versus many of our competitors.
And what has been, I'm sure there are many, but if you could, for a moment, just put your finger on it, what has been your proudest achievement? You've worked with many, it sounds like you've worked with many health systems and on a variety of projects. So I'm wondering,
well, I'll tell you, I think
excited about?
I think what's really unique about AMC is the focus on the patient. First and foremost, it's about the patient. We understand that in order to ensure compliance and adherence with this program, you got to keep it simple for the patient. Certainly it starts with technologies, but you have to adequately support those technologies for it to work. Probably our proudest achievement is just the appreciation that in those 70 to 75 different implementations we've done, no two are the same. The ability to kind of create a response that meets the specific needs of each customer and each of our customers' patients is truly a strength for us. The other thing I'll tell you is that, you know, as much as these programs look one way on the drawing board, they usually change between initial inception and actual go live. And I can guarantee you, even 6 months out, they're going to look different still. So we really focus a great deal on developing a collaborative relationship with our customers so that we can work together, understand where the gaps are, and work to address those gaps to ensure a strong program.
Sounds like you have to be tailored, or you have to tailor the programs, and you have to be nimble.
Absolutely.
Yeah.
Yeah.
So my last question is, what do you see as the greatest challenge, like just broadly, for telehealth to take hold?
Well, that's a great question.
That's a broad question.
That's a big one. I don't know if we have time.
Yeah.
Certainly, funding would be a nice thing. But if you take that off the board, I think we have to remember who the patient is. We have to keep it simple. Having great data for a multitude of devices for a patient for 2 weeks is great, but it's only for 2 weeks. We really believe that you can sacrifice you know, a large volume of devices to keep a patient engaged. It's through that engagement over an extended period of time that you're going to drive behavior modification, which is ultimately going to drive the success of the program. You know, the other thing I think is just, you know, where will these technologies go? And to what extent will these technologies continue to bring the price down so you can afford these solutions and these programs to a much broader patient population? That's where I think we're really going to start making a difference.